How are you guys doing with the homework? That color labeling? You guys okay with that?
Good, I really love it.
Okay, good. It's like gives you slows you down a little bit to get that stuff in a head.
And it's really helpful to start to make sense of the language.
Oh, good. Yeah, no, it is actually because it is hard to learn these new terms, and so it's good. I'm glad you're picking it up like that. So that's good. How about the health kit things that we're doing? How's that going?
Healthkit was helpful for me,
Hmm.
um, because I have like a lower back pain that I get occasionally.
Hmm.
So like some of the exercise and stretch that you listed, like especially in the first one, I think there was a lot of like back exercise that you put in there. That's some of them I did and some of them that I didn't do. So I started trying them, and I feel like it's been helping me.
Good, good. Yeah, we also if you're coming to the lab, we're also doing in person. We're also doing some of that stuff. The health kits in there. We didn't get to last week because it just was a huge week. But we're also doing some of that in person, and that's a good point. These exercises I'm giving you are not for nothing. These are the ones I'm giving to my patients that I'm learning that have been proven to really be helpful in situations. So you don't have to think you have to do all of these things, but keep the data in your head or with you, or make a copy or screenshot, or have the booklet thing and use them when you need them. So they're also here. I'm also trying to get you that knowledge for when you need to apply these things at some point, or you got people around you that need some support with this. Going through these health kits, I've realized over the years that it actually gives you sort of a lifestyle kind of coaching tricks, a little life tricks that you can apply or also share with other people. So that's good. Any other questions, comments on the last week stuff or anything? We're talking homework, color labeling, and the health kit. Those are sort of the big things right now. Anybody else want to talk a little bit, or have an experience, or have a question, or comment? That's good too. Doesn't not everybody has to like everything.
Do you have any suggestion for posture when sitting down on floor? Because for my work, I have to sit down on the floor a lot. Like I searched up some ways I could like improve my posture, but like I noticed that I'm like sitting down on the ground with my client a lot, like at my work. Like, and when I get up after sitting down for an hour, I like sometimes experience like a sharp pain in my back, and I know I'm doing something wrong. So I was trying to like figure out like a way to sit down. I know stretching helps, but like a posture when sitting down, if you have any suggestion to
Well,
that.
yeah, like you could put a pillow under your butt, for example. That might help. Raise the surface where you're sitting on a little bit, like the meditation cushion type thing idea.
Oh yeah.
That raises it a little bit. So because even a smaller pillow that's laying around or something will probably help somewhat. But yeah, something like that would be perfect if you have some ability to take that with you or have that around. And then the other thing that comes to mind, depending on when I was traveling, like in Asia, they squat a lot. And if you actually and that meant I squatted when I was traveling there, and some of you probably from home do some of that, and it was actually a really comfortable way to be in that position for a long time. So you just have to put the feet quite outward and not like have them straight forward. So play with that a little bit maybe too. But because the other thing you can get away with when situations like that is change the posture frequently. Adapt, not just be stuck in one thing, and then that becomes a problem.
Yeah, I think that's what I do wrong. I stay in one position for like almost an hour.
Yeah. That often is the case, and that's where if you can trick your body a little bit and just maybe even set a timer and say like after half an hour I got to change it if I forget, because you want to be focused on the client, and so you forget yourself, right? So maybe some tricks for yourself to help. But that's how I would approach it, because you can't just change not sitting on the floor.
Yes, thank you.
Good questions. Thanks for asking these questions. They're very helpful. I love talking about this stuff. I'm a nerd about this stuff. All right. Any other one, or we're good there, or comments or challenges? If not, we'll move to this week's material, I think. Let me see. How can I now do this, puppy? Hold on. The magic. Let's see. Ooh, it's getting bigger, and I can probably make it even bigger. There we go. And I can make me. Oh, I could stay like that, probably, because that's as big as we get it, isn't it? Yeah. Okay, so this week, can you see this stuff in the background, or is it too small?
Yes.
All right. Yes, meaning that we can see it.
Yeah, we can
Okay.
see it.
Good. So what we did week 6. Boing, close that. Oh, look, I should start opening more module. Although I don't want you to go ahead too far. Sorry, I go right with my list. But this week and then next week, we're sort of finishing up with the muscles going through the upper extremities and then the lower extremities. So now we're looking at arm and a leg. And so when I go into that and I open that, there we go. I get to, it's just take a moment to populate. Sorry about that. Not too bad. I try to close everything before class. I get to these tabs here, and I make these tabs according to what does the muscle do. So when I go into the first one here, shoulder anchoring muscles, which is actually where I'm at here, shoulder anchoring, then I'm describing muscles that attach the shoulder blade to the trunk. When you think axial skeleton, you think the trunk, the chest, essentially, and then the neck a little bit in this situation. And so those are a set of muscles that do that. So what you're looking for is muscles then that are attaching to the shoulder blade and to the trunk area. So you're not looking at muscles that attach from the shoulder blade to the arm, like not these ones. You're looking at these ones over here. So we're looking at ones like here, the one that goes up here, that's the levator scapula. That's actually not named here. You'll learn that. Here, look, it's named here right there. I think it has, there's a picture, because I didn't have a picture on the big one. And then we got the ones in the back, and then we got some in the front. And actually, you know what? Let me not go through them right now, because I'm showing them on the other slides for that. But then what we have is we have a set of muscles that attach the arm bone, the humerus, into the shoulder blade. And that's the rotator cuff muscles, because they are around the cuff of the shoulder. I think that's why I kind of call them rotator cuff. And then from there, we move into muscles that move the arm around. And here you still have muscles that attach to the trunk, because you want to have leverage to get from the arm. Well, not all of them, the deltoids not, but we only from the arm, a lot of it into the trunk as well. Like you got the pec, you got the lats in the back that are attached to the arm, move the arm around. And not but they're attached to the humerus and the trunk, and not the shoulder blade and the trunk. So that's the difference between the shoulder anchorings. I know it's probably a lot, but if you get an overview of like logically understanding what that machine needs to do to move around, then the muscle, yeah, it's like, then it's just which rubber band need to pull on what kind of thing. Anyway, so that's the arm movers, like the humerus moves around kind of arm. So now we got some muscles that anchor the shoulder blade into the trunk. We got some muscles that attach the humerus into the shoulder blade. And now we got the first set of muscles that move stuff around, really, in reality, that we understand. And that's the upper arm. That's the humerus then. So that's the upper arm movers. And then from there we go to the elbow movers. And so the muscles that we're looking at in the elbow movers, you always look from the proximal to the distal. So the muscles are always anchored more proximally to the joint that they move, and then distally is where they insert, so where they're pulling at. So the origin, right, is the anchor. The insertion is where they're pulling at thing, attachment. And so the arm, the elbow movers muscles are going to be found in the humerus. And then for our sense, we're going to then move the wrist around. And see, I should have said wrist movers. See, I need to change that. See, I'm still developing this class, so it's not consistent everywhere. So those are really the muscles that move the wrist around, the one that says forearm movers. And those are in the forearm because they move the joint that is distally further away from the attachment to the muscle. So the joint's always distally to the muscle that works it. I mean, there's always, when you say always in anatomy, you kind of mean almost always. So if you find an exception, let me know because I'm probably missing one of them. One I can think of here is the pronator teres that we're going to talk about. That moves that actually goes from right here and then here. So it moves the elbow this way. It doesn't really, or the forearm. It doesn't really move the wrist around. But anyway, that's sort of the overview of that chapter. Does you got some sensibility with that as a
Yes.
general idea? Then let me pull up the next thing and we go a little bit more into the detail of the things, if that's okay with you guys. Let me make this as big as possible. All right. And now I'm going to make me smaller and put me away here. Bye-bye. Come on, get away. There we go. Oops. All right. Okay. Sorry. I'm still learning this new program. You know, this program was told me about by the old arts director for Steve Jobs, the Apple guy, because he was a student in his class a few semesters ago. And so he told me about this. Anyway, so when we go into now more details on what we just talked about, when you look at the booklets, these are booklet things. You got the pictures all the way here. Actually, this is all right. Of the muscles really identified nicely, dissected out. When we then go into the shoulder anchoring muscles, the ones that we're looking at are, the first one I always look at are the ones here in the back. And the levator scapula, levator means elevating. So that's the muscle that lifts the scapula, the shoulder blade up a little bit. So that's attached to the upper neck and then the shoulder blade up here. That's one of them. And then below them, we have the good old rhomboids that a lot of you, can you guys unmute everyone, please? Let me find the muter here. Here, mute. There we go.
Dr. N.
Yeah?
So the levator scapula, is that like posterior to the scalenes, or where's that?
Good. Yeah. Oh, yeah. That brings me back to this. Great. Interrupting me is what you need to do. Otherwise we space it out, and I like the questions a lot. Okay. When we look at the question was the scalenes as compared to the levator. The scalenes are here in the front, and then you got this bump here, and that's the trapezius. This chunk here is the trapezius. And then if you look at the shoulder blade, you feel the shoulder blade. Let me know if you can't see it because I can't see it. You feel the shoulder blade ridge, the spine of the scapula, that is, you feel that here is your bump in the back, that ridge, and you follow that ridge all the way medially to the middle line and then go up, and that's where you find the top part of the shoulder blade. And that's where the levator scapula attaches to. So in terms of scalenes, it's behind the scalenes, posterior to the scalenes.
Awesome, thank you.
Yeah, no, that's good because this stuff, the more you have it, it's in your body, so we might as well palpate it. That's how we learn it. And then if you go further down, that's a little harder to reach. On the shoulder blade, then you get into the rhomboid muscles right in here. And those are named because they look like a rhomboid, two parallel sides kind of thing, but not a right angle. And then everywhere in the booklet, you have these things. These are the trigger points. So if somebody has pain where it's red, you can actually get them relief by working and squeezing the muscle where these X's are. And you sort of squeeze them all. You have to learn the technique a little bit, but a lot of us are really natural at this stuff, right? But you go to gently squeeze the muscle in these areas, because what you do is you squeeze the blood out of the muscle and get new blood coming in, and that really helps a lot with resetting the muscle. This is Janet Travell, trigger point work from Janet Travell. May not mean anything to you guys, but she's sort of the best of the best in this work that has established pain management through massage stuff, even in the legal field. She's passed away about 20 years ago. She's fantastic. So I took all her pictures and put them in my slides because I really think her work is fantastic. And some of you guys, I've always find some of you guys are into the tactile stuff like that. So anyway, that's the rhomboid. That's just a little note to what these pictures mean. If you didn't know. And then the trapezius is also a muscle that has the shoulder blade attached to the trunk, but that one also moves the shoulder blade. And so this is kind of an interesting moment to understand the difference between the deep muscles and the more superficial muscles. The deeper muscles, as they also move, but they're less movers and more posture holding type muscles than the superficial ones that then on top of the deeper ones can glide over the deeper muscles and move the body part more around. So you see that in the shoulder blade, these muscles here, they're holding the shoulder blade in like that. And then we got some in the front as well and underneath. And then the trapezius on top can kind of move the shoulder blade bigger, make bigger movements with it. And so then, you just start understanding how complicated this whole puppy is, because you got all these holding bands that move. So you got this suspended shoulder blade on the chest, because the only place where the shoulder blade is attached to the body is here in the front. And that's not a weight bearing joint. That's just holding it back so it doesn't fall forward. So it's not really a joint. So all the stuff it is a joint, but not one that is like a hip joint kind of thing. But so essentially the whole upper extremity, the whole arm is attached to your body via all these muscles. So you just kind of keep that in mind. So that makes it very interesting. I always visualize when I try to work on somebody, I visualize it's like a suspension in 3D with all these muscles pulling, and which one is not firing right, which one is too much. And then you can kind of, you'd have to do that. That's just what goes on in my head when I try to help people. But that's how complicated this stuff is. It is and it isn't, right? It's a visual thing. And so, but maybe that way, then the muscle names, they become secondary. It's more a question of understanding it. Does that make sense, or is that way too much?
Makes sense.
Good. And then we also attach that shoulder blade in the front somehow. And we got two muscles doing that. We got one that's here in the coracoid process. That's the one with the coracoid in the front, the shoulder blade point in the front, really what that is. That hook. And so that goes right to the chest. That's the pectoralis major. You will learn that. Actually, here's a bigger picture. These are all buccal pictures. And then the pec major, because that's the one on top. That's the big muscle on the front. But underneath, and that muscle moves the arm. That's a different motion. That's later. But the one underneath, again, anchoring more something, not necessarily moving. The pec minor anchors it. I have an 82-year-old guy. We worked that pec minor, re-established functioning with some weird technique. His oxygen count on holding the finger oxygen meter thing went up because his breathing improved. So this becomes an important breathing muscle at some point. When we do the lungs, we talk about that a little bit. So anyway, but we have that pec minor in the front, and then we have one muscle that attaches in the back of the shoulder blade. Like if you flip the shoulder blade back, this is the rib cage. You see the attachments right here in the back part and underneath, and then it goes into the rib cage and pulls that shoulder blade into the rib cage like that. And so you see the muscle on the models, you see them coming out like this on each rib. And they call it serratus anterior because when the muscle attaches to these ribs, visually it becomes looks like a serrated knife, like the bread knife, the one with the thing, not the flat one. And so they end up calling it serratus anterior. Or maybe the verb for the muscle was before the knife. I don't know about that. Anyway, that's you can see it on people if they go a little cuckoo on their muscles. You see it up here. We're Are you seeing what I'm doing? Yeah. All right, good. Because I'm actually good because I'm not seeing myself. You see it how it comes out here, and you can see it sort of sticking out like fingers. That's serratus anterior. Anyway, then that's really the few muscles that attach the shoulder blade to the trunk, and from there, then you go into the muscles that attach the arm into the shoulder blade. And actually, then I used to term not an anchor, then I used to term attach. So that's sort of in my mind how I change the terminology a little bit, but Anyway, then on those muscles are all on the shoulder blade. We have 3 in the back and we have 2 in the front, 1 in the front. The back ones, look at the names. What we've learned already in anatomy, shoulder blade bone terminology, we learned the spine of the scapula, and we learned the supraspinous fossa, and we learned the infraspinous fossa. And then actually, I don't know if you learned that, but then there's a subscapular fossa underneath. This is what attaches to the rib cage. And so then we have muscles that have the same names. We have a supraspinatus, supraspinal the scapula, an infraspinatus, infraspinal inferior fossa, and that's just a muscle, infraspinatus muscle. And then we have one that's known as the subscapularis muscle. That sub means underneath, like a submarine is underneath the water, right? And then we have one that we have a weird name for, but then that's the fourth one that helps. And so when you take all these first letters together, it spells SITS, SITIS. Supraspinatus, infraspinatus is teres minor and subscapularis. So that's why that name is up there. So people call those the sits muscle. If you ever go and hear somebody talk, I don't know if you have, because I've been in this field for so long. But they're also known as the rotator cuff muscles or the sits muscles. You probably heard of rotator cuff tear or also frozen shoulder. That has to do with these muscles and with the capsule around the shoulder. So those are the ones that hold the arm, the humerus, into the shoulder blade. And then you could go in detail learning about those. Oh, by the way, which is probably a good place to do that. Let me see if I can mix this up and get this back. What I want to show you briefly is, there we go. When I go to this stuff here in the canvas, up here we have these pro tips, I call them. And on here, these are cadaver videos. And let me just push on that now and see what happens if it takes too long. But what I did is I took DVDs and cut these muscles out. So you have a catalog of all the muscles, but then each muscle has a clip behind it. Oh, this is the low back. Has a clip behind it. It's like a minute or 2 minutes long, and you can click on it, and then it goes to that. So if you click on that main thing, it goes to this whole catalog. But if it's this one, see this? But if you clip in here, when you say pronator teres, for example, let's not do that. That's a big one. It's that one down here. When you do let's say the levator scapula, we clip on the clip here, and it goes right to that thing. Now you have to be okay with looking at, but you're learning bones, so you'll be all right. I don't want to do that. Skip. And then you click on that.
Levator scapulae arises here on the outermost part
and
of the
it
first
shows
three
you what's
cervical
going
vertebrae.
on
It
in 15 seconds.
On the upper medial corner of the scapula. Levator
in a real
scapulae
thing.
helps to elevate the scapula.
So that can, for some people, be very helpful to visualize. So some people might think it's a little gross, but if you eat meat, you don't have to do it, but you can. So that's why they're pro tips. You don't have to do all of these resources. These resources are here to tap into and make learning easier and hopefully a little fun too. I mean, I have to make a project with learning. That's why coloring and labeling is good. I can't just do reading a book. That doesn't really work. And then I put something behind a PDF that has every muscle. Just to see this one, we just learned this one. It's a pec minor. So it's every muscle like that, individualized, and you can print it label, color it. But also, this is good for flashcards because you can cut it out, put it on a flashcard, or trace it. Because whenever you do with the material with your hands, remember I said learning goes, my old pedagogical grandfather guy, the head, the heart, and the hand. You gotta think, but if you have a buy-in, why should you think about? Why should you care? And you do something with it, it's gonna stick in the head. Just reading a book is not gonna stick in the head. I mean, at least not for me. I can't say for everyone. And then, so those are cool to kind of make stuff with. And then the last one I did is more of a digital thing. And look at that. You could download that and you have all the muscles that you're going to have to know on one page. And you can zoom in and you can say, all right, what muscles did we learn already? Look, here we're learning the pectoralis major. And you have them in a way where you see the attachments on the bones, and then it's a line. And I wrote this stuff in because this was actually for me. Look at here, the rotator cuffs. This is for me to visualize all that. When I work on a patient, I have to see where the attachments are. So I found a textbook that visualizes these things like that. And so I figured, a few of you might like that. And so I put it here just in case. I went a little further and I made another document that I'll send you over in a text that I first have to find again, where I make tables with pictures and stuff. So maybe some of you like that too. I'll send you guys that over this afternoon as a text to just, you don't have to use it, just in case, I mean, we all learn differently. So it's sometimes a little, I want to present with different material, different ways that you can tap into what works for you. All right, so where was I? I think I did the rotator cuff, right? Yeah, good. So that. All right, then let's go back to this puppy here, and then move forward. And when we move forward below all the muscle details, then we get to the arm muscle mover. So this is muscles that move. We call it the upper arm. The humerus is also called the upper arm as compared to the forearm. Terminology-wise, we can use that. I mean, you can't say the upper arm is humerus, but in colloquial language terms, when somebody says the arm, it's a whole thing. But once you've been in a class sort of setting and you understand more, then this is called the arm, this is called the forearm. So now we're talking about the arm movers, big one, pectoralis major, moving stuff in the front. You can go more in detail. What I would do with this again in detail, I think I told you last time, I would watch the video. When I talk about more detail, I would then look at the picture. I would look at the origin and insertion and action and visualize it in yourself. Maybe do it. The other thing you can do is you can go the action. See, here's adduction. That adds something to the body. So you can resist that motion and hold on to something, and then the muscle pops up and you can feel it. And so that's another way to learn if you want. So you could use the add action that way, because you don't have to do that for the test. But the more you stimulate your brain with these activities, the more the test is just a breeze. And it's more important that, after that you have knowledge. The test is like, it's just, I know it's important as a student, but at the end of the day, it's not really the most important thing. It's just a part of the pathway. Anyway, so pec major is in the front, and then we have the latissimus dorsi. That's the big one in the back. As I showed you or told you before, these are still attached. Let me actually do this. Let's see if I can make this bigger a little bit. I should have. God, why didn't I think of that? Toolbar, view, normal. Take the ribbon off. Ha! Good. There you go. The arm movers are also attached to the chest a lot of times, or some of the scapula, but more proximally to the bone that they move around. So we have the latissimus, and then I mean, it's a bit bigger now. And then we also have the deltoid. That's the pocket muscle here that moves the arm in all kind of different directions. That's a big one. And then we have a couple of smaller ones that help. One of them, the one we talk about, is the coracobrachialis. I like that because you often have muscles terminology be where the muscle attaches. And here is very clear: the coracoid process and the brachialis. Remember in the first chapter, the upper arm, there's a brachial area. So now you reach back, and so every word you read, and whatever you read, you say brachii, that's going to be the upper arm. So that's why that first chapter picture with all those body areas, that's really important or really helpful, and makes your life easier the more you understand that. Another muscle we have that's a smaller one that helps is the latissimus dorsi. Helps the latissimus dorsi is the teres major, and so that's interesting too, because that's right next to the teres minor. These are cousins, but they do two different things, because one of them goes and attaches to up here, holding the bone into the shoulder blade, and the other one attaches to down here, moving the arm around, helping the latissimus dorsi. This might be a little much right now, but anyway, if it's not the logic, go with it, and otherwise don't worry too much. Go back, go do the videos, and then understand the more details afterwards. And I'll make a video of this so you can go back to it if you want. And then from there we move to the muscles that move the elbow. And then look at the elbow. What does the elbow do? The elbow does this, and then it does this. So let me make sure I'm not obstruing. So the elbow does this and this. And so I mostly have muscles in the front, and then I have muscles in the back. And so when I look at them, the muscle in the front, as a general muscle in the front, is going to be the biceps brachii, or we have two of them. The biceps brachii, again, look at the word brachii, and then brachialis. Look at the word brachii. So again, you know the word brachii, you know where the stuff's at. And then, so those are doing the front one in the front. And then in the back, we got one big one that does the back, and that's the triceps. You guys heard of that word probably. Tri means three, ceps means head. Brachii means where it is at, the area. We also have a smaller one that reaches from the arm here all the way to the forearm. That still helps flexing it, but that also helps moving the wrist a little bit that way. It's just stabilizing it. And that's the brachioradialis. So now look at that word. Brachio, you know it's the upper arm. Radialis, you know it's going on the radius somewhere. You're assuming that somewhere along the line, or at least that's where you're looking first. Because if it would be the brachioradialis and it's going to the ulna, that would probably be a bit weird. And so there is that level of logic to this whole thing. I think this picture is pretty good, showing you the flexor when they bring the arm, flex the arm up. The three ones that do that. What's the common part? Brachii is common. This is the tennis elbow. People get a lot of pain in here because when you tennis, I don't know, if you play tennis, you hold a racket in here and you flick that thing up like that, and you move this a lot. So it becomes overworked and it hurts. Okay, and so from there, then all we're going to do is we're going to go to the forearm. And in the forearm, we're going to have muscles in the front and we got muscles in the back. Let me see what I can visualize the best here. When we look at the muscles in the front, when you look at muscles in the front, for our purposes, we're looking at the top layer of these muscles. We don't go deeper. The deeper you go in this situation, then the further away they move. So the deeper muscles move the fingers. The superficial muscles move the more proximal part, which is the wrist. And so those muscles are all attached to the, and again, when I say all, we're meaning most of all there, are attached to the medial epicondyle. If you go deeper, then for the finger flexors, which we don't work on or talk about, then you go more just to the forearm attachment versus the medial epicondyle attachment, because that's up in the humerus, really, at the end of the day. It's that thing sticking up right up here. But if you go down here, then those are all these muscles to go to the front. All the muscles that go to the back, back up. All the front muscles do this. We got different ones. They do a little more this, a little more this, but generally they do this. They flex the carpi. They flex the wrist. Remember, we had carpal bones, and in the chapter 1, carpal is the wrist area. And then the muscles that flick the wrist up, they extend the wrist, those are all going to be on top. And those are all, for our purposes, attached to the lateral epicondyle on the outside. So that gives you sort of the generality of these muscles. And then what we do, we go into detail. So in the front, we got 4 muscles. And I'm going to tell you that up front. I'm just going to do that first here, and then you go through the lecture, and then you do it again, because this is how I learned these muscles, and I still have it in my head like that. And I work on, we've been applied this stuff. So this is not a bad way of working it. So you have 4 muscles in the front, and what you do to remember those, you take your hand, the web of the thumb, you put it in your medial epicondyle. Can you guys see that? Here, and then you lay the hands down forward, and they go over on the forearm like that. And so from here, we're going to the forearm. I got to do this here. The thumb is here. I'm going to the forearm like that. And so I lay these muscles down, my fingers down the way the muscles are. And then I can talk about the muscles, because then I have a muscle that goes right here. Sorry about the background. And then I got a muscle that goes further down towards the thumb. Oops, there's my thumb. And then I got one that goes right towards the fingers. And then I got one that goes on the pinky side. And if you remember now, the muscles from the bones from last week, then when you work on these names, then you have a muscle that goes along where the ulna goes. You got a muscle that goes along where the radius goes. And you got a couple more, the one that goes straight across. And what that does, it pronates the forearm, that brings the palm down. And you go back in understanding that, because remember when you did motion, pronation, supination, flexion, extension, those things, it's about the motion. So that muscle is kind of cool. It attaches right here and goes over and brings the palm down. That's another way of understanding these muscles. If you go, let me actually show you the pronator real quick, since we're talking about that specifically. It's right here. See, it goes across fairly high up. And so that's why where am I? That's why it brings the wrist down where it does this motion. And what you can do is you take one hand, a thumb on the attachment, the origin, and then the other, the finger, further down where the insertion is, and you bring them closer together, and then you get a feeling of what the muscle does when it contracts a little bit. And so that's another way that I'm sort of trying to get these muscles into my brain up here, or for me, because I actually have to do muscle tests. So it's very important that I really understand all the details of that. So that, watch the video and then go through them on this video again, maybe, and I'll make one next week too in lab as well, I think. The last one in the front that we're going to study is the palmaris longus, and the way I remember that's the one goes, if you look at that muscle, it goes nicely into the palm of the hand, wherever that went. Right here, palmaris longus. See, you get one muscle that goes all the way here, and you have a web of the hand. So when you actually do this is that muscle right there. You can see it sticking up. If I'm showing that right. Yeah, you can. No, you can't see it here. Hold on. Yeah, you see some line coming up here. That's that muscle. And you have that. Most of us have that. Not everybody has that muscle. 10% don't. But most of us do. And it goes into the web of the hand. It's not really a strong muscle, but it holds the hand up. So it sort of helps the whole finger holding, the finger flexion and lifting up a bag or something like that. So it's an interesting muscle. Anyway, that's those 4 that you need to learn on that. And then when we go to the other side, to the back, we only have 3 that we learn. And we have, instead of then flexion, this is then called extension. And instead of carpi is still carpi, but you have then no palmaris longus or no pronator, because you don't do that motion there. But where we go into that then is we go into the digits, and the digits means finger. So we have one muscle then there that are moving. These are the extensors that then move the finger. So you can see that going right to the finger in here, to the end of the finger actually. And if you do this with your fingers, that's what that muscle does. And so you'll learn that muscle. We also have the ones on the front. They are called flexor digitorums. We just don't study those because you get so many muscles. And I figured if I expose you to the word on the back side, we are okay with finding one in the front that says flexure. Those are underneath. See, if you ever interested in looking, they're flexor digitorum in here, deeper ones. So we do have them, but I'm not making you study them. Okay, good. So that is a little bit of an overview that I have. Anything, questions, or is that helpful or not helpful? Feedback?
Yeah, I have a question.
Please.
How do you, what does like terrace mean?
I think it means triangle or something. Let me look it up. And terrace, I forgot. I'll look it up and then I'll send it over to you guys. Yeah, I'll look that up later. Yeah. I thought it was triangle. It's something like that. Sliver or something like that. It's kind of a weird muscle because it's really small, but it's really important. If that muscle is messed up, and I have a lot of patients that actually is a muscle that really harbors trigger points and gives people pain. It's very interesting. Any other question? Sorry, I couldn't. Actually, we could look it up real quick right now. Nah, it doesn't say. I gotta go a little deeper. No. Okay, no, I'll look into that a little bit later on and then text it to you guys. Well, if we are not having any questions, then the other thing is what we're going to do this week. Other than the lectures and the coloring and the labeling. I think
I do have a question about last week's. I don't know if you went over it.
No, in the beginning I asked questions, but yeah, ask. Please ask. Talk about it.
Yeah, I came in a little late.
That's all right.
I want to ask questions about the posture evaluation. I was unclear about that assignment. You what did you want us to do for that one?
Let's go. So first, actually, with that, we will be doing that tonight in class. Because last week I didn't get to it, and I mentioned it in class that if you're, and actually I extended it because I realized I should have extended in the beginning because you can't have a week of doing exercises if I don't give you a week to do so. And so I extended it. So if you have turned it in already, that's okay. Just keep doing them, and I'm grading them as I go along. But what?
Yeah, I didn't turn it in yet.
That's all right. I changed. I should have changed it to the 10th before I opened it. I didn't, and so I wanted to mention that too. I did that this morning. I recognized that. But if you go into it, so if you come to class tonight, whoever's coming, don't worry about doing it. And these assignments, the posture, and then also the injury prevention, which we're starting this week, we will do in the lab as well. So if you're in person, you don't have to do them online. You do them with me in lab. So just want to make that announcement. I started making that announcement where I can. But in terms of the posture, so what do I want from you guys? I want you guys to, part one, place some kind of visual indicator on the certain parts of your body. So we have a few views that we want to take. So basically, if we're looking at posture, we're looking at how is my body in gravitational field. So when I stand, my head is really forward, that gravitational field goes way down fast, and that makes a lot of these muscles really tight. And the body uses a lot of energy, which tires us faster than if we don't do that. So that's the background why posture is actually helpfully and important to analyze. Most of the time we do it when we get pain, and then the PT does it, and we get a little idea of what's going on. So I want us to go through that. So I want us to place a visual on these prominences. These are parts that we learn in the chapter. And then, like little colorful labely things or a tape that has a dot on it. So it's something you can see, because then what you do is you take pictures of yourself, and you close your eyes while you put a camera up. These days we could do the phone. You don't even have to do a tripod. Just put it somewhere on the wall and somehow figure out how to take the picture or the selfie, so to speak, and have it on delay or so, because most phones can give you like a 10-second delay or so. And then of course, if you have somebody do it for you, it's better or easier. And then you go to the place where you want to take the picture, and you close your eyes, march in place a little bit, a few steps, and then come to a stop and be neutral the way you think you're standing neutral without opening your eyes. Keep those eyes closed until the picture is taken. And then, of course, you open your eyes. And then you do that from the front, from the side, and from the back. And then you look at the landmarks that you placed before on your body, and you analyze those. And you can go, and I think I put a printout behind here, a worksheet. So you can click here and it goes to a sheet that you can download. Or you can take a screenshot, go on your iPad, and then do it from there. That's totally cool too these days. And then what I want you to do is I want you to analyze your dots on the picture and connect the lines. So you connect the dots and you see, look, at this is like, here my pelvis is way forward. It's not a straight line. It should be a straight line down. So this is not a straight line. So the way I'm standing there is like this. And that's not neutral. There is a problem with some kind of holding pattern. And that's not, and so I want you to do a little bit of that analysis with yourself. Now, if it's not, fully exact, that doesn't really, do the best you can, because you're going to get the idea of how you sort of are in that field. And then ideally what you do is to correct it, you mirror image. So if your head is forward, you bring it back. And the trick is actually this: most people's head is forward. That's really the biggest postural deviation that we have that makes the big impact. And so what we then do as a second part, then here you analyze it, blah, blah. And then you can watch a video of somebody else doing it. It's only 4 minutes, so that's not too bad. And then I want you to answer these prompts, which I just kind of talked about a little bit. And then as a part 2, I want you to go through these exercises. And I want you to implement them in your daily routine and make a little tracker of them. What did I say here? I want you to do them, I think, on top I say 3 times a day for 1 week. 1 week in this context is 5 days, as far as I'm concerned. And then you see if there is you feel a little difference. For example, when I do this, as a matter of fact, I mean, my neck, one time I threw out my neck and I would wake up in the middle of the night in searing pain when I had a dream, and in my dream I would move my neck, and so it was really crappy for a few weeks. And so this exercise actually is what fixed my problem. Actually, I think it was the Brooker. It was this one a little bit more, where I also pulled these back, and I did this part at the same time, the retraction, and that made enough room in this back that my disc problem, that was the disc problem that I had, an inflamed disc, it increased the space, that it decreased the inflammation and all. So what I want you to do as an exercise, I'm just telling you, this is useful stuff in case you come into a need potentially. But what I want you to do is I want you to go through these a few times a day for a week, and then answer these questions, next week and by Sunday. 5 days again is 1 week in my world. Why do we stretch muscles, and what muscle groups these exercises stretch, and which feels best to you? And then you upload all of that, and then you get all the points. That makes sense?
Yes, thank you.
Mm-hmm. You're welcome. Yeah, these are a little elaborate. Just take a little time. Don't do them all at once. Take the pictures, and then if something is a little bigger, we're going to have a pathology project coming up in the latter part of the course.
Question: do we have to upload pictures of ourselves?
Please, no. Thank you. I thought I'd written it in there. I don't need you at all to upload your pictures. That's one reason why.
You just want us to do the dots.
Yes, that's one reason why and you know what? That's a good point, because I had some people put out pictures and I thought I have it in the text. No pictures necessary. That is not important at all. What's important is pictures, just that you have that you look at it, that you analyze it. Because at the end of the day, what's most helpful for you is that you have an idea of how you stand, your posture. And so the diagram, load me that up. That's fine. That I see that you did the work. But no, don't. I don't need you to share the personal stuff. No, very important. Privacy is crucial, please. Please don't put stuff on the net that you don't want on the net. And that includes classes. I mean, I know that this stuff will go out, but you freaking never know these days, So be cautious with that. So then we'll have a labeling this week. That's normal stuff. I just want you also to fill out. We did it last week already. You fill out the origin insertion stuff and name it. So that way you write. So that way it slows you down a little bit. So you write. You can copy that from the text. I mean, it's not more than that. But I want you to visualize it when you write it. So that's then the process that helps you then be ready for the exam.
Is this week's assignment?
This is this week's. Yeah. Last week was the trunk muscles. And if you haven't done last week's, yeah, that's cool. You just work your way through it, because this week and next week it's a lot of material, but it's a little less heavy because we're going towards studying for making then the exam. And so, and the exam is me pointing to structures and you looking at the list of all the terms which you have, let's talk about that real quick too. If you haven't gone to the test review, go to the test review and look at the couple things. The anatomy term list. I hand it out in class all the time. It's all the terms that you're working through now doing the homeworks, but they're all on one list. It's not coming up. It's too slow. Shoot. Now it is coming up. Or something is. And then this one, I have review videos of all the structures that I want you to know on the test, where I point to them. These are also a couple or so might be off a little bit, but generally they're on target. And then here I actually even have study sessions put behind that are videos that I did in class, in costume even, so to entertain you, trying to make it more fun. But you can look through that too, and it talks about the muscles again, all of them. You always see here's the list with the term list, so that you could print out, and then you have all the terms that you need to know for the test in front of you. So that's why that is helpful. So if you haven't done that, do that now, because again, it's a finite amount of terms that I want you to know, and I don't want you to have anxiety about it. Oh, and then on the test, all you have to really do is copy that term from the list to a spot in the thing and tell me what it is. And so that's for that. If you haven't done that yet. And then this week we start the injury prevention evaluation. So we start in that. That's a 2-weeker. So actually, I think that's not even. No, that's a 317 when that's due, because what I want you to do is I want you to learn about biomechanics a little bit. And then I want you to, where is the next thing? And then I want you to do an injury prevention evaluation that's consisting of 12 tests that I use that are orthopedically all, this is like top of the line stuff to do to help your body not get injured. So what these tests do is they test different abilities, either muscle strength or flexibility. And then one is on cardio a little bit. And then they give you normative data and tell you how much you should be able to do at your age group and your sex. Sorry, this is a binary thing. We haven't caught on the other parts yet. And then that gives you an idea of where you have some weaknesses in your system, that if you want to be an active person, do sporty stuff, but you're a regular also, but you could work on a little bit and make a 5-minute routine. That's part 2 or part 3 of this whole thing. And then you do those a little bit and get better in one of these areas that you have a little weakness in. So when we go through these tests, the first test is a balance test, because a problem with balance is people fall. When we're old and we fall, we go to the hospital. That's not a good idea. And so balance is, and often with young people, I have a lot of young people, they can't balance no more because they don't practice it. When you talk to neurologists, kids and athletes, kids and all that, they engage them in all kind of agility training early on, because not computer based with the hand agility, with the body agility, because of that stuff. And so that's one of the tests that we do in the practice. This is not, I didn't make these up. These are, I studied these over the years and in diploma programs. And so then from there, so that's an easy test to do. from there we go to one that's a squat test. You need to be able to move against gravity. How many squats can you do? Then you got the side bridge. Your trunk muscle needs to be strong. And again, then the other thing with these is this gets, some of these are a little tense. If you have pain doing them, stop them. Don't keep doing them. Talk to me. So don't push your way through these. Use this as a little bit of a guide to see, hey, maybe that's a little bit where I need to work on a little bit more. Not a negative. It's just, every time I do this, I find one area where I should work a little more on because I forget. Because then besides the muscle strengthening, the other thing that comes in is the damn stretching stuff. So that's actually more important almost, or it's equally important. So we want to look at the hamstrings. We want to look at the flexibility in the ankle in this part of the thing, because the more flexible this is, the less you're going to injure it. Unless it's wobbly. That could be too, but that's a different discussion. And then we have a little bit more, muscle testy. And then look at this hip flexor test. We also need to know how are the hip flexors, because if this is tense in here and you can't do it, if it goes like that, you're gonna have problems. And it's an easy fix. But if we don't fix it, then we're gonna get injured, and then it's not an easy fix. And so that's another reason why I put these in. And again, not everybody's interested in this stuff, but in here, it helps me teach you the muscles of what we work in a sort of way that's also useful to you. So that's why I'm doing this too. And blah, blah. We have a few of them. We end up with a 3-minute step test again if it's too much. If you have red flags like your blood pressure is really high or something, then don't do any of that. Be careful about these kind of things. I think I write that a few times somewhere. So be careful about these. No, when pain, don't do it. We don't want you to injure anything. And if you have a little hard time with the cardio, don't be over pushing yourself and pass out. We don't want that either. And then after that, and see here the normative data that we kind of have, what the pulse rate should be or could be. And then you answer all these kind of questions. You do this parallel because the question is pretty much goes with the test. And then you implement. And then you say, what would I like to improve on? And you make a little 5-minute routine, and you do the routine using the table. You do it for 5 days. I have to go through these again. Usually I do stuff for 5 days. But do it, for a few days, and then you answer a few of these questions here, and then you're done with that. So this is a bigger one. So I give you for 2 weeks on this one. I don't know if I want to extend it 3 weeks because we're going to move on to the next section that we're going to do. But if it's too much, let me know. But go slowly. Don't do all of them at once. Do them a little bit at a time. Good. And if you're coming to class, you don't even have to worry about it. We'll just do them in class. That's part of what we're doing in class. All right. How you guys doing with all of that talking on my end?
Good.
Good? Sensible enough? Questions?
Pretty good.
Okay. Good. So any questions right now, or are you all right? I'm pretty low here.
I think I'm okay.
Okay, good. Yeah, no, these muscles are cool stuff. So if you have any nerdy ideas, thoughts, you want to talk about it, you don't, text me. We could do that. I love this stuff.
How long is the second test going to be?
It's gonna be, I think it's 55 questions or something. Let me see. It's online. It's a few hours probably. Let me see what I give you guys. Oh, I got to get out of the student view.
Is that the test for the final or no?
No, that's the bone muscle test. So when we look at the test, we have the first we had, and now we have a bone muscle stuff. And so we do a test on that. I give you 3 hours for the thing. And it's 54 questions. So you should be plenty of time. And each question, wait, I can share this real quick with you. There we go. I'm learning this new program, so I'm a little slow. So I could preview it. So if you go into it, so you got 3 hours, you got 54 questions. I ask you 3 things. I ask you bones, I ask you landmarks, which are more detailed structures on a bone, and I ask you muscles. And this is slow because I'm actually using all the RAM for recording stuff. But when I present the material, so then you have your term list on front of you. I went through that real quick. If not, if you need help, let me know. Text me to get that. I can ship it to you or show you where it's at. And then you have the term list in front of you. So you know all the terms that I want you to copy into the test are on that list. And then on the questions, you have pictures and you have videos of the pictures. And so what I did when the pandemic started is I went to the class and I just put dots with numbers on the structures and took pictures and then made a little 15-second video of it. And that's why it takes so long. And then I posted it up. One of the things with these Canvas thing, when the things are a little bigger, it's either greatest to take a test or a quiz on a mobile device, or not Safari, because I'm using Safari right now. It's taking forever to go up. Use Chrome or something. But I think if you have a Mac, you're probably already aware of that kind of stuff with Safari sometimes. So unfortunately, it doesn't load up. But is that sort of sensible the way I'm describing it? Who asked the question? I forgot.
Yeah.
Okay.
Yes, it is. Thank you.
Okay, good. Yeah, it's not going to load up. I'm sorry about that. It's too slow. Oh, look at that. Let me just keep talking about it. Maybe it'll come. So, look at that. There is one. So the first, I always go through the first because it shows you what a landmark is, because one of the mistakes or the difficulties to convey is the fact the landmark versus a bone. And so landmark is part of the bone. The bone would be the frontal bone, but I would ask, what's this bone, and have a mark here, not right where the arrow is, the specific landmark. Oh boy. And there it went. And then you saw that picture, right? And then I have basically the same thing in a video of like a 10-second. I go like, what's this called? And I point to it. And that's basically how that goes. All right, good. I think we got to leave it at that probably. All right, but is that clear enough?
Yeah, thank you for showing us.
Oh, you're welcome. Thank you. Yeah, we'll do more later. Good. Any other questions or comments, concerns? Well,
is that this week's test?
No. This is not now. This is not till the 24th. Well, on the 24th is the due date. So this is all the terms from the skull to the facial muscles. We did the skeleton now, and now we do the trunk also. And now we're finishing up with it's still not going. Now we're finishing up with the upper arm muscles and then the leg muscles next week. And then so we have this week, and then we have next week, and then we have the following Monday, and then the test is on. It might go open. I might open it a little early, but it's like 2 weeks or something. So if you haven't started studying, repeating, going through the test review thing a little, and maybe reviewing the homeworks a few times, or doing some of these things, sort of studying for it, I would start now. Even if that means you're just watching videos on the review, that's fine. I have people before, they would watch those videos when they fold laundry instead of watching a TV show, and then you just slowly get that stuff in. But if you do last minute, then it's always overwhelming, even though it's an open book test, So yeah, and make yourself notes on that term list, because give yourself hints and cheat sheets and stuff like that. Because you have 3 hours for the test. It's plenty of time. And so it's supposed to be really working through the material again. Good?
Yeah.
You're still here. Good. Well, with that, I should probably get off my soapbox and stop talking, because we all have stuff to do. Any other things, last minute questions? Or I can also stay afterwards in case you want to talk privately. But if not, we wish you a good day and a good
Thank
week.
you. Good day.
Thank you, Doc.
Thank you.
Take it easy, y'all. Bye.
Bye.
Bye-bye.